I actually had a patient come in to see me last week who said, "Hey, Dr. Islam, I have been told that I have cirrhosis. What is that? And what are some of the long-term complications from that?" So cirrhosis is whenever you have scarring of the liver. There are a couple of different stages of scarring or fibrosis that we have. And whenever you have stage 4 fibrosis or scarring, that's when you actually have scarring all over the liver. Now, before you hit stage 4, you have the opportunity to reverse what's going on in your liver. The liver does a very good job of reversing some of the damage you may be having, whether it's from alcohol, whether it's from herbal medications, one of the more common causes for liver disease, whether it's from fatty liver disease, whether it's other complications. Your liver does a fantastic job of being able to reverse back to normal if you get rid of the toxin that's causing it to be injured. Once you hit stage 4, though, that's when actually you have scarring over your liver, very much like a scab that you have over a cut. And when that scarring occurs, that is not reversible, and that's when you get to cirrhosis. Now, when you have cirrhosis, there are different grades of how bad the cirrhosis is. We use a score called the MELD score or the CTP score to allow us to determine what the score of your liver is doing whenever you are cirrhotic. And based on that, we can determine how severe your liver may be. So once you have cirrhosis, the ship has already left the shore. You really can't go back beyond that. But I can tell you, we can help manage your cirrhosis to make sure it doesn't get any worse. Now, there are a couple of complications that can occur whenever you have cirrhosis that you have to be aware of. Number one, you can develop what's called ascites, which is fluid around this belly. Your liver is made to help produce protein, and whenever you have cirrhosis, you have the inability to produce enough protein, and when you have lack of protein, you have a significant amount of fluid around the belly. Now, fluid can either be drained by putting a needle in there and removing that fluid, or we can give you medications that pee out that fluid. It's the first complication. The second complication is a condition called hepatic encephalopathy, which is confusion because of the buildup of the toxins inside your body. So your liver's function is to help get rid of toxins and remove those toxins. If the liver is scarred over, you cannot remove those toxins. They can build up and cause people to be confused, have problems with sleeping. Maybe they have a reverse sleep-wake cycle. They are awake all night and sleep during the day. They may not remember things that are going on. They may have difficulty driving. And one of the ways that we can treat that is we help you poop out the toxins by giving you medication to make you poop a lot more. A third complication is that you can develop what are called varices or dilated veins inside the esophagus. So just like varicose veins in the leg, you can have the same veins inside the esophagus because of the scarring that's causing backflow of blood up into the esophagus. And the biggest significant risk factor for varices is that they can cause significant bleeding or vomiting of blood. And unfortunately, this is a complication that can occur for anybody who has cirrhosis. And then lastly, irregardless of how your cirrhosis is, there is a chance of you developing liver cancer. And this can happen no matter how well we treat the cirrhosis, or no matter how well we treat the liver. And this is why typically we'll get imaging and blood testing every 3 to 6 months for anybody who has cirrhosis, so we can keep an eye on the liver and we can catch the possibility of developing liver cancer early and potentially treat you before it becomes a significant problem. So unfortunately, cirrhosis is a very common condition. The most common reason for cirrhosis currently is fatty liver disease. In the past, it used to be hepatitis C and even alcohol, but now the number one cause, can you believe it, is fat that accumulates in the liver.